Hey, compassionate caregivers and neuronurses. Have you seen café-au-lait spots on a child's skin, or heard of tumors forming on nerves? You may be looking at neurofibromatosis, or NF, a group of genetic disorders that can affect everything from the skin to the spine to the central nervous system. Let's explore the signs, symptoms, management strategies, and most importantly, the nurse's role in lifelong care. Neurofibromatosis is a genetic condition where tumors called neurofibromas develop along nerves. It can affect the skin, bones, eyes, and brain and comes in two primary types. So first, there's NF1, which is more common. It's caused by a mutation on chromosome 17, usually presents in early childhood, and involves skin changes, skeletal abnormalities, and learning challenges. Then there's NF2, also more common, which is caused by a mutation on chromosome 22. It's characterized by vestibular schwannomas, tumors on the auditory nerve, leading to hearing loss, balance issues, and cranial nerve deficits. There's also schwannomatosis, which is a rarer variant with chronic pain and peripheral tumors. Let's talk clinical manifestations. First, you've got skin changes like café-au-lait spots, which are flat, light brown birthmarks, freckling in the armpits or groin, and cutaneous or plexiform neurofibromas. Neurological complications can include learning disabilities, especially with NF1, as well as headaches and seizures. With NF2, you might see hearing loss and vision problems. Musculoskeletal issues are also common. Think scoliosis, bone deformities, and short stature. And yeah, even though these tumors are often benign, depending on their size or location, they can cause significant pain, disfigurement, and disability. So, when it comes to diagnosing neurofibromatosis, it's really based on a thorough physical exam and a detailed family history. Genetic testing is available, and that's becoming more common. We also use MRI or CT scans to keep an eye on tumor growth. For folks with NF2, audiology exams are important, and for those with NF1, regular eye exams are key since optic gliomas are pretty common. Now, management is definitely a team effort. Surgical removal of tumors is considered when they're causing pain or affecting how things work. Sometimes radiation or targeted therapies are used. And of course, providing support for learning and developmental delays is crucial. For people with NF2, hearing aids or cochlear implants can make a big difference. As nurses, our role starts with careful skin assessment, documenting and tracking the size and number of lesions, and watching for any changes in texture, pain, or sudden growth. Managing pain and symptoms is a big part of what we do, since chronic pain can really take a toll. That means coordinating both medication and non-drug therapies. Psychosocial support is also huge because body image issues, bullying, and anxiety are all too common. We need to offer referrals for counseling, support groups, and peer networks whenever possible. Patient and family education is vital, teaching self-monitoring for any new or changing symptoms, and stressing how important regular screenings are for neuro, vision, and hearing. And don't forget to promote genetic counseling, especially when it comes to planning for a family. Alright, here's the bottom line. Just because you can see neurofibromatosis on the skin, doesn't mean it's simple. Its impact goes way beyond what's visible. Nurses are central to early detection, education, and lifelong support for patients and families as they navigate this really complex condition. Are you caring for someone with NF? I'd love to hear how you're helping them feel seen and supported, and hey, don't forget to like, subscribe, and follow for more insights about rare disorders because every spot tells a story and every nurse truly makes a difference. And remember, observe, support, advocate.